Good morning. My name is Merrick Green. I'm the founder managing partner of the law firm General Counsel PC. With us today is David Peruano, who's been helping us with the permanent standard. Will be taking the lead in the webinar today. But thank you very much for joining us. We had well over 100 people sign up today, and we have a few more signing in. But since it is 10 o'clock, I think it is good to get started on time, so hopefully we can be finished by 11 o'clock. As we go through, there is the questions tab available within the GoToWebinar toolbar. Use that for questions, and we will answer them through the webinar or at the end. And then we will also be providing a copy of the webinar and the recording to everyone after the webinar. So with that, we will get going. Just quickly, an overview about General Counsel. As indicated, it was founded by Merrick Green in 2004. We serve as an outside general counsel to small and medium-sized businesses, nonprofits, individuals, and foreign companies for their businesses throughout Virginia and across the U.S. We've been actively helping Virginia businesses with COVID compliance plans since the temporary standard came out in July. And we have 4 primary practice areas. We help businesses with corporate M&A, contracts, and things along those lines. We help with labor and employment law issues, everything from employee handbooks, non-compete, non-solicitation agreements, to helping them defend employment discrimination lawsuits and those matters. We have a full government contracts practice, helping contractors and businesses work with the federal government. We have a dispute resolution litigation practice, and coming in the next few weeks, we are actually adding a family law practice also, and then there's a link to our website. So with that, David Peruano is going to take over and get into the meat of the presentation. Thank you.
All right, good morning, everyone. So as Merritt said, I will be talking about the new permanent standard that Virginia issued for COVID-19 protection and prevention in the workplace. So Governor Ralph Northam announced that, as you see at the top, that keeping Virginians safe at work is not only a critical part of stopping the spread of this virus, it is key to economic recovery, and it is also the right thing to do. So the permanent standard became effective on January 27th, 2021. Most of it is already effective, and employers should have everything in place already. It is enforced by the Virginia Occupational Safety and Health, which is under the Department of Labor and Industry. This permanent standard applies to all employers covered by VOSH, which is most employers in Virginia, except a few, which we will discuss later. And as I said previously, most of these requirements should be in place immediately, except for the 2 things which you see in the next point, which would be the infectious disease preparedness and response plan, which should be in place by March 26, 2021, so about a little over a month and a half from now. The full permanent standard can be found at that website. And if we go to the next slide, we can talk about the applicability of the permanent standard. So as I said previously, the permanent standard applies to all employers in the Commonwealth that are covered by the VOSH, which would be all private sector employers except for maritime employers, contract-based employers for the U.S. Postal Service, and any employers located within federal facilities. This also applies to most public sector employees, but there are a lot of exceptions. And if that is you, then it is probably best to consult with your supervisor, because you have your own reporting and standards that you must be putting in place. If we
David,
go to the next slide.
One question that we've had from a number of folks is relevant to part-time employees and contractors, independent contractors. So if you only have 10 part-time employees, does the permanent standard still apply to you?
Yes, for the purposes of this permanent standard, whether you have contractors or part-time employees, they all count as an employee for the purpose of this standard.
and to clarify that, contractor. So if, let's say, you're a small physical therapy practice, and you only have 3 independent contractors who work on their own. So they're independent contractors, not employees. What about the applicability in that regard?
It would apply because you are paying them something. They are still employed by you. You have some sort of working arrangement with those people, with those contractors.
Okay. And I think a lot of those, if you have questions, you should talk to legal counsel. Sometimes it'll depend on the circumstances, whether someone is a 1099 or W-2 for that regard. So next slide.
Okay, so what are the key changes that came from the permanent standard from the temporary standard? Well, the first one, the permanent standard really relaxed reporting obligations by employers, and we will get into that a little bit later. Next, the PS, the permanent standard, modified the return to work requirements, removing the test-based approach that was permitted under the permanent standard. There is a new return to work plan, which is much simpler and more streamlined. The permanent standard also explains that face coverings must be worn over the mouth and nose and fit snugly under the chin and should have no vents or valves. So it really defined what a face covering is and how it should be worn. And it also clarifies that a face shield does not qualify as a face covering unless you have a medical condition that allows you to wear a face shield. Under the permanent standard, if the employer can show goodwill and good faith efforts to implement this plan and to offer PPE despite the lack of availability, the employer will not face any repercussions from the state. And also the permanent standard requires that employers in the very high, and medium risk categories, which we'll talk a little bit about later as well, to implement enhanced ventilation controls for air handling systems. That would be your HVAC systems. So if we go to the next slide, we will talk about the risk categories that are outlined in the permanent standard. So the first one is the very high category, and I would say that most employers probably would not fit into this category because this would be employers whose employees have a high potential for exposure to known or suspected sources of COVID-19 that are aerosol generating. So this would be things like laboratory specimen collections, autopsies, surgical procedures, things like that are not very common in the workplace. The next category is the high category, and employers in this category are performing tasks that would likely expose them to COVID-19 within 6 feet of separation from persons, again, known or suspected to have COVID-19. So this could be things such as mental health providers, nursing homes, correctional facilities, mortuary facilities, things like that. The medium category, I would say most employers fall in this category, and it is because it's the most broad and the most risk prone, I would say, in the sense that this exposes employees to a lot of people, even though that it might not be within 6 feet of distancing. So what does this mean? If your employees are cashiers or they are waiters, things like that, they are still exposed to a large amount of people, but they are not as exposed as any of the other categories. So employees in this category might include food processing plants, restaurants, bars, gyms, entertainment services, schools, daycare facilities, bars, spas. So it really covers a wide range of employee categories. And the last category is the lower category. And employees in this category would be employees that have minimal contact with either employees or the general public. This would likely be accounting firms, law firms, things like that, where people really can stick to their own closed offices and can implement minimal workplace controls, such as just wearing face coverings, maintaining 6 feet of distancing, things like that.
David, what is the general recommendation for a business that has more than one standard for their employees? So let's say an engineering business that has, or plumbing, home services business that has, office staff, that's probably in the lower category, but a number of folks that go out into the field that are probably within the medium category. What do you generally recommend as to their risk category when they're thinking about their compliance obligations?
Right. So in that situation, it is recommended that the employer, choose the highest risk category that applies to them. So in a plumbing scenario, if their plumbing staff falls within the medium category, but they have office staff who would fall into the lower category, it is recommended that they go with the medium category, just because there is a chance of cross contact between office staff and technician staff, and it would implement a standard policy across the board in the workplace.
And in this circumstance, the additional obligations are not that onerous.
Right.
Right.
So next we're going to talk about the requirements for all employers. This would be regardless of your risk category. So the first thing that all employers must do is assess your workplace and job tasks and classify each task according to the correct risk exposure level. So this means each task that your employees might do, the employer needs to go around the workplace and categorize each task into a risk category and ensure that each job task is compliant with the risk category that corresponds to it in the standard. Employers must also inform employees of methods of self-monitoring for COVID-19 symptoms, and they should encourage self-monitoring. Employers should also develop and implement policies and procedures for employees to report when they are experiencing COVID-19 symptoms. So this means that, law permitting, that employers should establish a system for employees to easily and quickly report to their employer when they have received a positive COVID-19 diagnosis. And we can move to the next slide. So this is the requirements for all employees continued. Again, employees must create a system to receive reports of positive COVID-19 by all employees. This includes subcontractors, contract employees, temporary employees, any paid employee who is present at the workplace. Employers must also implement a return to work plan. They must enforce social distancing. They must sanitize and disinfect the workplace. This, of course, can be done with the help of the employees, but the employer, and we can get into this a little bit later, but the employer must provide proper sanitation and disinfection materials. And the employer must ensure compliance with PPP requirements based on exposure level. So this means if you are in the lowest category, ensuring that all employees are wearing face coverings, and if you're in the very high risk category, making sure that your employees are wearing all the necessary PPE, such as gloves, gowns, N95 masks, things like that. And when engineering, work practice, and administrative controls are not feasible or do not provide sufficient protection to the employees, the employers must provide PPE at no cost to the employee.
And why don't we go ahead and answer a few questions as we're going through here. So this first question, and I apologize, goes back a slide or two. So sorry to clarify on the previous slide, are you saying that the employer will not be held accountable if it's not providing PPE? And that goes back to a statement we had, which is that the new permanent standard has a good faith carve out, a safe harbor for employers. And it says that if PPE is not readily available and it's not being provided to an employee, there may not be a violation. I think what you need to consider in that circumstance is that PPP is readily available. So I don't think that is a carve out, and I think that all employers should have PPP available for their employees. I have not heard of circumstances where they have not been able to obtain it. Question number 2 for now is, would hotels be considered medium risk? And how I think about medium risk, and how, and David mentioned, it really is probably the largest bucket, the largest aspect, the largest part of the companies out there. It's folks that are customer facing. You're dealing with customers and clients, as part of the business. So I would put hotels within that risk category. So yes. And the next question is for PPP compliance. What if I have employees with health conditions that do not make it possible for them to wear face coverings? I think there are two things as it relates to that. One, you have to consider the Americans with Disabilities Act and the request for accommodation, and whether that accommodation is reasonable without undue hardship for the workplace. So that's a legal analysis that to a certain extent is beyond the scope of what we're talking about today, and also the permanent standard. David, quickly, does the permanent standard talk about disabilities or the inability of certain people to wear face masks and other requirements?
Yes, it does. So the permanent standard does mention that if an employee has a valid medical condition that impedes them from wearing some type of PPE, they should communicate that with the employer, and they should really try to wear and utilize the most amount of PPE that is permissible to them. So, for example, if an employee cannot wear a tightly fitting face covering for whatever reason, maybe they can substitute that for a face shield. So while it's not as effective as a face mask, it is still some level of protection.
Yeah, and again, I think you really need to go into your analysis there under the Americans with Disabilities Act. What is a reasonable accommodation, and whether it's an undue hardship. So in that circumstance, if you're working in a very high risk environment, or mortuary, a doctor's office, and there is a nurse or another worker who says, I can't wear a face mask, it might not be reasonable to have an accommodation in that circumstances for the risk that it would entail. So you need to go through that analysis. And if you have those circumstances, I would speak to an attorney about it. Next question is, 6-person office, must you wear a mask even if you have a 6 foot is maintained? And I'll let David chime in also, but generally speaking, within an indoor environment, you need to be wearing your mask in any common areas. The exception is if you are in for example, I am in my law firm offices right now. I have my office door closed. I am not wearing a mask. If I go out into the hallway, I put on the mask. David, is within the permanent standard. Any further clarification on that?
No, I think it echoes what you said. There is an executive order issued by the governor that says what you said. In any face covering must be worn while indoors in common areas, and at all times when 6 feet of distancing is not possible, outdoors or indoors.
Good. All right, one more question and then we'll continue with the presentation. But I think it's good to get some of these questions contemporaneously with where we are within the presentation. We have a food production factory, not customer facing. I'm still assuming medium risk category. David, why don't you go ahead and take that?
I would say yes, likely still within the medium risk category, because your employees, if they are constantly within 6 feet of each other in tight quarters, they probably still are exposed to a relatively large number of people within 6 feet. But that can be tricky, and I think that certain circumstances like those, you'd probably need to speak to an attorney to determine exactly what your risk category would be.
No, I think that's right on. And one thing is, if you haven't visited the General Counsel website, and we have the covidcomplianceplans.com, we have a little tool that you can utilize there to determine what risk profile you have. It doesn't provide every circumstance perfectly, but it does guide you in the right direction as to what risk level you would be. All right, let's continue.
Okay, so now we're going to talk about how to determine if an employee has COVID-19 symptoms and what steps to take. So if an employee is experiencing COVID-19 symptoms and has not received an alternative diagnosis, meaning COVID-19 has similar symptoms as a cold or a flu, but if there has not been an alternative diagnosis, such as yes, this employee has a cold or a flu, then the employee should be designated as suspected to be infected with COVID-19. And employees known to have COVID-19 or suspected to have COVID-19 should not be allowed to report to work, remain at the workplace, or engage with any customer or client-facing work until they are cleared to return to work. And we'll touch a little bit about that later. But employees with COVID-19 symptoms or with COVID-19 are still allowed to telework if the employer allows it, and if their job tasks allow it. And if we move on, we will now talk about the return to work plan, and that's what I was just talking about. This is a plan that is set up by the employer, and it will help guide both the employer and the employee on what steps to take for when an employee who is known to have or suspected to have COVID-19 wishes to return to work. So the employee known or suspected to be infected with COVID-19 that was or is symptomatic must be excluded from returning to work until three things are met. One, the employee is fever-free, and the permanent standard defines this as below 100 degrees Fahrenheit for at least 24 hours without the use of fever-reducing medications. Two, there are no respiratory symptoms or they have cleared up significantly, and this is such as shortness of breath, cough, things like that. And three, at least 10 days have passed since symptoms first appeared. Now, there are a lot of employees who will be or might be asymptomatic, and these employees must be excluded from returning to work until 10 days after their first positive COVID-19 test. And this hits on a very key point that we've had a lot of questions about is, can the employer require an employee to pay for a COVID test? And the answer is no. The permanent standard does not allow an employer to force the employee to pay for this test. It's considered a medical evaluation for work purposes, and therefore the employer must assume the cost. Now, if the employer offers a health insurance plan and the health insurance plan covers the full cost, and the employer says to the employee, you can use the work-sponsored health insurance plan, that's okay. Employers can do that.
So, and I think this is something important to highlight, and it's a slight difference from what you had initially under the emergency standard, because there were two return to work plans. There was the time-based and the testing-based. And for folks that were symptomatic, they've moved away from the testing base. So as you see here, if someone's tested positive or else they are known or suspected, you need to go through this time-based. You can't just say, well, I tested negative, I want to come back to work. You need to go through that time here. All right, continuing on, reporting requirements.
Okay, so this is what I was mentioning earlier about employers must set up a reporting system for employees who are known to have COVID-19 or suspected to have COVID-19. And this applies for, again, all subcontractors, contract employees, temporary employees, full-time employees, etc. So when an employer receives a report of a positive COVID-19 report by an employee, the employee must notify the employer within 24 hours of the discovery of possible exposure. And with this, the employer should notify other employees that the employee was working with during the exposure period. The employer should notify the building or facility owner. And the employer should also notify the Virginia Department of Health when the workplace has had 2 or more confirmed cases within a 14-day period, and the Virginia Department of Labor and Industry within 24 hours if there has been 3 or more confirmed cases within a 14-day period. Now, it's important that when employers are reporting this to the required parties, that they keep the identity of the employee anonymous and confidential as far as permitted by law.
Great, and let me go ahead and jump in with 2 quick questions. First, as it relates to the return to work plan and for employees who are known or suspected, there are 3 sort of requirements. You must be fever-free, your respiratory symptoms must have improved, and at least 10 days have passed. The question was, are all 3 points have to match? And the answer is yes. You know, the requirement within the permanent standards is that you have to have all 3 of these. You know, and the follow-up question was, what does symptoms have improved mean? And the permanent standard doesn't, you know, provide a technical answer on what improved means. It, you know, I think it is a matter of good faith discretion and reasonableness that the symptoms have improved so that someone is not having a horrible cough or other respiratory issues, which could be indicative of that they are symptomatic and potentially still contagious and spreading the germs. Someone's coughing, they're more likely to be spreading the virus. So you don't want that, and you want that to have improved. All right, with that, David, can we move on social distancing?
Sure. So this is another requirement for employers under the permanent standard, and it is important to implement social distancing at the workplace. So the employers must establish and implement policies ensuring that employees practice physical distancing while working and during paid breaks at any place inside the work facility. Employers should use verbal announcements, signs, and other cues to promote and remind of physical distancing requirements. Employers should also limit non-employee access to the workplace or restrict access only to certain areas to reduce the risk of exposure. You know, I'm sure we've all seen a lot of restaurants, for example, are doing curbside pickup, takeout, and this is in an effort to promote social distancing. Another thing that employers can do to promote social distancing is to limit the access to common areas, break rooms, lunch rooms, etc., to control capacity to encourage social distancing as much as possible. And this can include having signs, verbal announcements, you know, having somebody at the door of the cafeteria or lunchroom, limiting how many people can enter at any one time. And it is important as well that once employees are done using these common areas, that they wash their hands, that they sanitize their space, and they disinfect any shared surfaces. And if we have no questions on social distancing, we can move on to sanitizing, which is the next step.
David, one question going back. The person says, sorry if I missed this. Can we require an employee to take a test before coming back to work after he or she has been out for positive COVID? So it's not whether it's symptomatic or asymptomatic. I know we talk about if someone's asymptomatic, you can have them 10 days after a test. Can you still require an employee to have a negative test before returning to work, or does the permanent standard not allow that?
I think the permanent standard, well, the permanent standard does not say whether or not an employer can require. I certainly think that an employer can implement that policy in addition to the return to work plan. The employer should also note that if they choose to implement that policy, they can't force the employee to pay for that. That's a cost that must be taken on by the employer. But I certainly think that in addition to the return to work plan, the employer wishes to require a test. I certainly think that's a valid thing to add on to the return to work plan.
Okay, so to clarify, so the permanent standard requires the time, the 10 days. If the employer wants to go one step further and have a test, they can, as long as they're assuming that cost. All right, moving on to sanitizing.
Okay, so sanitizing. I think I've said this many times now, but it's important to go over again. Employers must provide employees proper disinfectant and sanitizing products, and this is actually defined in the standard permanent standard as N rated by the EPA. And something like Lysol, for example, Lysol wipes would fall under this category. But it is important that employers encourage and remind employees to wipe down all common spaces, all common tools that are shared, any common areas. And I mentioned tool. It's important that employees disinfect and wipe down any tools that are shared before passing on to the next employee. It's important that employees frequently wash their hands, use hand sanitizer, and use any other cleaning and disinfectant products that are available to the employee. And the employer should also, again, encourage frequent hand washing, frequent hand sanitizing, and frequent disinfection of frequently touched surfaces, either by other employees, by customers, or the general public. And
Very
if we have
good.
no questions, we can.
No, and what I am going to do though is someone just provided some interesting feedback as it related to the testing question we just had. And I think this is probably something that a number of us have come across in the past, I guess we're going on 11, 12 months now. But it's one of the reasons why the permanent standard and the CDC is not requiring employers to do the testing as much, is because the testing can sometimes be ineffective. Sometimes you have false negative testing, sometimes it doesn't test positive, and sometimes the virus can be still in your system if you do test negative, which is why the time-based requirements for return to work now is what is the recommendation. So thank you for that feedback, and we can move on to the next slide.
Okay, so requirements for shared work vehicles. This might seem like a trivial thing to include, but it is a very important thing that the permanent standard really outlines, that any employer who has work vehicles that employees must share, it's important that the employer encourage and inform employees that the importance of being safe while in these confined spaces that work vehicles pose. So it's important for the employer, in conjunction with the employees, eliminate the need for shared work vehicles if possible. If it's not possible, it's important that the work vehicle has access to fresh ventilation. For example, cracking the windows or not putting the recirculate feature on the heating or cooling system. Encouraged physical distancing in the vehicle. However, if that's not possible, it's important to maximize the separation between employees in the work vehicle. This can include seating occupancy limits, sitting in alternate seats, or things like that. In addition to that, if separation and the limitation of sharing a work vehicle is not possible, the employee must be provided with respiratory protection such as an N95, KN95, or something similar, a face piece respirator. And if these N95, KN95, etc. respirators are not available, the employer shows a good faith effort to provide some sort of face covering. That is okay as well. I know that there can be difficulty obtaining these N95, KN95, etc. So providing face covering is okay. So now we move on to the infectious disease preparedness and response plan. So this plan must be implemented by categories in the very high, and medium category, and medium is only for those employers who have 11 or more employees. And this plan is meant to be implemented in the workplace to map and guide both the employer and the employee on what steps must be taken to prevent an outbreak of COVID-19 or other viral diseases, but also what steps to take and what protocols need to be in place if there is to be an outbreak of COVID-19 in the workplace. So this plan must be in effect by March 26th, so a little over a month from now. and it is a very important part of the permanent standard.
David, I'm sorry, this is Merritt, if you're going to talk about this in your next slide or two, but having the infectious disease preparedness and response plan was a part of the emergency temporary standard, and I imagine a number of the attendees today may have implemented this within their compliance for the emergency temporary standard. Is the requirement under the permanent standard for the infectious disease response plan similar? Is it different? Or will you talk about this in the next slide or two?
Well, I'm going to talk about it in the next slide or two, but it's largely very similar, but there are some key differences that we're going to discuss. So it is important that employers revise their existing infectious disease preparedness and response plan because of this.
Thank you.
Sure. So now let's get into the key requirements of this plan. So the plan should designate and identify a person to be responsible for implementing the plan. This has sometimes been called the health advisor or the plan advisor, whatever title you want to assign to this person. And this person should be knowledgeable in infection control principles and practices applicable to your facility, your service, and your operation. Now, this doesn't mean they have to be, somebody with a degree in immunology, but it should be somebody preferably in upper management or in a senior position who knows the key aspects of your business and how to manage each piece of that in the event of a business shock like an outbreak of COVID-19 would create, and how to respond to that quickly and efficiently, and how to be able to move on from that. The plan should also consider and address the level of COVID-19 associated with various employment practices. Now, that is already a requirement for all employees, but it is highlighted in this plan. So this entails the where and the hows and the whats of each job task in the workplace, and what types of work and administrative and engineering practices should be implemented for each job task. It should also consider and address any contingency plans that must be in place in the case of an outbreak in the workplace. And this should account for things such as increased rate of employee absenteeism, understaffing, the need for increased physical distancing, staggering work shifts, delivering services remotely, such as curbside pickup, things like that, or even full teleworking operations. And we can move on to the next slide if we have no questions. This just continues on the requirements. The plan should also identify infection prevention measures, such as frequent hand washing, disinfecting, hand sanitizing, things that we've already discussed. It should also provide for prompt identification and isolation of employees who are known or suspected to have COVID-19. It should quickly and promptly remove them from the workplace and prohibit them from coming back in to prevent the spread. It should also address infectious disease preparedness with outside businesses, such as subcontractors, delivery personnel, teams like that in general, who might not be part of your operation but are key in delivering services or products. And it should also identify the mandatory and non-mandatory recommendations of CDC and Virginia guidance on infectious disease prevention. And if we have no questions, we can move on to the training requirement of the standard. So the training for the very high, and medium exposure risks have a training requirement for all their employees. Now, this training will include information about the permanent standard. It will include information about COVID-19, what it is, how it's spread, things like that, how the employee can take actions to prevent the spread of COVID-19 in the workplace, and any risk factors that are associated with COVID-19, and what can happen when somebody's infected, and any increased risk factors that people might have. It'll also discuss proper PPE usage in the workplace and all the other requirements of the permanent standard, such as the anti-discrimination requirements and the infectious disease preparedness and response plan if it applies to the employer.
Great. And before we move on to the next slide, this is Merritt. I'll jump in with one or two questions that have been asked. So first, And as relates to the infectious disease preparedness plan, does this apply to who have more than 11 employees but are all part-time? And just part-time, as we talked about earlier, is not relevant for the analysis. What is relevant is number of employees. So a part-time counts the same as a full-time person. We will get a copy of the slideshow to everyone afterwards. And then please confirm that this plan is not required for low risk requirements. Yes, the disease preparedness plan is for the medium and high risk employers. And we'll talk about this a little bit more in the next few minutes. But one of the advantages of the COVID compliance plans that we have developed is it walks you through that process, tells you what you need, and then in one email, you get all the documents you need, including training videos that help you comply easily with the standard. But with that, David, why don't you continue, and we will go to the next slide.
Sure. So the training requirement for lower risk employers. The training requirement for lower risk employers is largely the same as the ones we just discussed. The only difference is that lower risk employers and medium risk employers with 10 or less employees are not required to implement the infectious disease preparedness and response plan. So the training has no need to touch on that, but everything else is the same. And the training requirements for both this category and all categories must be in effect by March 26, 2021. So again, a little over a month from now. Now we're going to talk about the anti-discrimination policy that is outlined in the permanent standard. So employers are prohibited from discriminating against any employee who either exercises the rights under the standard of the health and safety provisions, for raising any concerns about COVID-19 infection controls, whether that's to a fellow employee, management, or a government authority, or who voluntarily provides and wears their own PPE. Now, the caveat there is that the PPE that the employee wishes to use must not pose a hazard to either themselves or anybody else, such as other employees, customers, etc. Now, the requirements for the very high, and medium exposure risk categories. So in addition to all the requirements to in addition to all the requirements for all employers, medium, high, and very high employers must implement enhanced ventilation controls for air handling systems. They must install physical barriers, such as plastic sneeze guards, things like that, where it's feasible. And before each shift, it's important that employees pre-screen or survey covered employees under this plan to verify that they do not have signs or symptoms of COVID-19. I'm sure we've all seen people taking temperatures, etc. It's also important to limit non-employee access to the workplace or restrict access to only certain workplace areas to reduce the risk of exposure. This we've already kind of talked about, but it just echoes on the requirements. And we can move on to the next slide if we have no questions. This is just a continuance of that. So where feasible, the employer should implement remote working, should implement flexible work hours and staggered shifts, should implement flexible meeting and travel options, such as using Zoom or webinars or things like that when it is possible. They should also deliver services remotely, such as curbside pickup, telemedicine, things like that. And we can move on if we have no questions. So the PPE requirements for very high, and medium exposure risk. So all employers should provide at least face coverings to non-employees suspected to be infected of COVID-19. That means that any general public or customer who comes into your facility who is suspected to be infected with COVID-19 must be provided a face covering. Additionally, employers shall assess the workplace to determine if COVID-19 hazards are present that mandate the use of PPE. And if the hazards are present, the employer must have the employee use the type of PPE appropriate for the risk exposure level, and verify that the required COVID-19 hazard assessment has been performed through a written certification. So complying with the written hazard assessment and making sure that all employees are using the appropriate PPE. Employees classified as very high or high exposure should also be provided with gloves, a gown, face shield, goggles, etc., whatever is required to prevent the spread of COVID-19 when inside 6 feet of patients or other persons known to be suspected with COVID-19. And PPE requirements for employees in the medium risk category will vary by work task. You know, it could be something as minimal as just a face covering respirator, or it could go up from there. It just depends on the job task. So implementation and timeline. So the permanent standard mandates that most employers implement the majority of the standards immediately. A lot of them should have been in place already by January 27th. However, the standard does allow up until March 26th to implement the infectious disease preparedness and the training requirements of the standard. But everything else should have been implemented by now. And so we're really getting close to the deadline for all the other requirements. Now, the safe harbor provision, I know Merritt briefly touched on it earlier, but this also expands on it. The permanent standard allows for some flexibility to the employer. So if the employer, you know, in good faith is complying with any other recommendation, whether by the CDC or the Virginia Department of Health or any authority, or is doing their best to comply with the permanent standard and is unable to because lack of availability of PPE or things like that, the state does allow some flexibility to the employer as long as they can show good faith efforts to comply and protect their employees and their customers. Now, penalties. So this standard is administered by the Virginia Occupational Safety and Health, and the penalties under that department vary between $12,000 all the way up to nearly $130,000. So $12,000 on the low end for serious violations and $130,000 for willful and repeat violations. Now, the amount fined will vary based on the severity, degree, and willfulness of the violation. And so, you know, that is something to consider, but these are some pretty hefty fines that come along with non-compliance.
You know, and with that, yeah, go ahead, David.
Oh, I was going to say this is where you know, COVID compliance forms generator comes in. We, General Counsel, have been working with business compliance to create a quick and easy way for employers to be able to comply. They will log into this website that's listed on the third bullet and answer some questions, and they'll be guided on all the forms that they need. So it's quick, it's inexpensive, it's easy to use, and it will provide all the documents and training materials, signage, everything that you need in one package.
You know, and this is Merritt just quickly, and just to give you a backstory, when we first, the emergency temporary standard came out back in July, you know, we started helping clients with compliance and putting together the materials, and there was significant confusion and cost associated with compliance. So we determined that we could put together some packages. We've actually had to expand those. For the emergency temporary standard, we just had a medium, low, medium, and high. There are additional packages now. But you can see here, and this is also on the website, covidcomplianceplans.com, or you can also get there through our General Counsel website. But you see we have 4 packages, the cost for those packages, and what you receive. You know, so if you're package 2, which is a medium risk, so retail or customer interaction, 10 or fewer employees, you get an employer checklist. That's really a roadmap for that employer on what you need to do to comply with the standard and have a safe workplace. You have the same sort of checklist for your employees. You have the return to work plan. You have the COVID training, which is a PowerPoint presentation. And we've gone ahead and we didn't have this for the emergency temporary standard, but we've taken that training and we've created it into a webinar, which is now both in English and in Spanish. And I guess, David, the webinar was, and the presentation was in Spanish also. So that, that is a great perk, and you get that free of charge. And then you have an employee acknowledgement form where employees can acknowledge that they've received the employee checklist, the return to work plan, and the training. So that also complies with the statutory requirements. So we've tried to make this as easy as possible. When we were doing this for clients back in the summertime, it was costing several $1,000s to provide these materials individually to clients. But by doing it for hundreds of clients throughout Virginia, or excuse me, hundreds of businesses, it's been able to be done in a much more affordable way for those businesses. And as the chart that you just saw shows, these are the different things that you get. So it really is a comprehensive package that allows employers to comply quickly, easily, and in a comprehensive manner with the permanent standard. The reviews here, and we'll pass this on, but we've done this for hundreds of employers throughout Virginia, and a number of those folks, or really all of them, have said it's just a great product. It makes their life much easier, saves them time, and it's really helped their business. So here are some more reviews. And then we have a few more questions which I'll address, but just do want to emphasize that if you use the discount code webinar, you'll receive a discount of 10% off the packages. So please consider doing that. And we will follow up with an email providing everyone a copy of the PowerPoint presentation and a copy of the actual recorded webinar. So with that, let me make sure we have a few more questions here. If employees voluntarily sign a waiver releasing the company of liability and wants to go into the office before we're requiring the employee to come back, does the employer still need to check their symptoms? So really, the permanent standard provides requirements that are not waivable. You think about OSHA standards, workplace safety standards on a construction site. Those are governmentally placed safety standards that can't be waived by the employer or the employee. Same circumstances here. You have the permanent standard. It provides certain standards for a safe workplace. They can't be waived. So I would keep that in mind. Next question is, can you show the low, medium, very high standard slide up again? I'll forward this to you in the next hour or so you will have that. And you will get an email with the copy of the webinar. And it says, is this mandatory or enforced by the police? It is mandatory. And there has been enforcement. I don't think it is enforced by the police now. David, is there anything within the permanent standard that you've seen as it relates to enforcement?
The enforcement is really being done by the Department of Labor and Industry, and they can perform audits and random safety checks. That's as far as the permanent standard goes.
Good. Well, good. Well, I always want to make sure that we are respectful of your time. So it is now 10:54. We don't have any additional questions. Please don't hesitate to email us at ccp@gcpc.com if you have any questions. I hope you do visit the covidcomplianceplans.com. It's a great product that we've been happy to share with employers throughout Virginia. And thank you so much. Take care and goodbye.